So today we are going to conduct a cat dissection. And really this is to isolate the muscles in the cat. So in order to do this, there's certain equipment that is needed. First of all, protective equipment. So that includes lab coat, gloves, goggles. The fixative that's used to preserve these cats is toxic, and so having an area that is ventilated and having that eye protection and skin protection is also very important. In terms of physical equipment, obviously the cat tray, where the cat is going to be laying. The utensils that'll be used will be a blunt-tipped large forceps, a probe, again blunt-tipped scissors, as well as a scalpel. So in dissecting the cat, you can notice that the skin has already been removed from the cat. So at this level, we're looking at the remaining connective tissue, and we can even begin to see some underlying muscular tissue. So in order to really isolate the muscles, it's important to remove that connective tissue. And so the connective tissue that is really important to get rid of is the loose connective tissue, and in particular the adipose tissue, which is the fat, as well as the areolar connective tissue, which is a loose connective tissue that is important in nourishing the skin because it's highly vascular. It has lots of blood vessels, and that is important because epithelial tissue does not have its own blood supply. So in removing this connective tissue, one of the techniques is, instead of pinching perpendicular to the surface of the cat, I use the technique where I pinch on using the side of the forceps and moving in the direction of the tissue so as to remove it. So I'm really just going to start from an area where there seems to be a lot of connective tissue, and then proceed working from the anterior down to the posterior. I'll start on the ventral side and then work my way to the dorsal side. All right, so just as an example of what this tissue looks like, if I can get a close-up, you can see right here in the back there is adipose tissue, and it's a yellow tissue, and it's just fat. And so that is something that has to be removed, and it looks like this cat was not very fat. It was rather lean cat, so there's not very much adipose tissue, but what is there needs to be removed. And then the areolar tissue, I can point out later as it becomes a little bit more evident what that tissue is. But the goal of removing the tissue is to reveal the muscle fibers. And so you can tell that the way that these muscle tissue is arranged is in fascicles. And those fascicles are, they end up creating a striped pattern in the muscle. And so that's the level that we want to remove the connective tissue. So as soon as you can see the striped pattern in that muscular tissue, then you can start removing the connective tissue. Because if you go beyond that, you'll actually end up destroying the organization of the muscle itself, and you'll lose some integrity in your muscle. So I'm just gonna try to proceed, and again, working with the side of the forceps and just removing the connective tissue. And you can see it comes off relatively easily. So I'm just working to remove this connective tissue. And the thing with the loose connective tissue is that it doesn't take much to remove it. You see how easily that comes off. And that's how you know you haven't gotten down to the muscular level, which is again another reason why I like to use the side of the forceps as opposed to grabbing like this. Because when I do that, I've now got a hold of some muscle, and I don't want that. So just continue to remove this connective tissue, and actually we'll get to a point where you can really use your hands So the hands is another, using your fingers is another way to safeguard against getting too much muscle, all right? So we're just removing this very loose, and I'm not having to exert very much strength at all to remove that. And actually, I've just revealed some areolar tissue. So if you zoom in into this area right here, you can see that it's somewhat spiderwebby. And there'll be another example of that when we get down to the legs. But that's what we want to remove. So as soon as you can see the striping of that muscle tissue, that's how you know you've gone as far as you need to go. So what I'm going to do now is, just for convenience, actually use my blunt tip scissors and cut this areolar tissue off. Now you might mistake this areolar tissue for skin, but it's not skin. This is connective tissue, which is very different from epithelial tissue, which is what skin is. So this connective tissue is laying over top, serving kind of as a boundary between the muscle and the skin, and this is what we are going to remove. So in using the scissors, what we want to do is hold whatever it is that we're trying to cut with the blunt tip forceps, and then use our scissors to cut. We never want to grab whatever the tissue is with our fingers and cut, because then we run the risk of cutting our gloves or cutting our fingers. So that's why we use our blunt tip forceps really as our fingers. And so I'm just following along at the point of connection. And the other utility of the blunt tip scissors is that you can actually use it to clear it out, clear this tissue off and disconnect it from the muscle. As opposed to if they were fine tip scissors, you might end up poking into the muscle. But with the blunt tip, because they're rounded, it's not going to catch, and so I can have a smoother cut. So this is areolar tissue. This is what we're removing so as to reveal the muscle underneath. So I'm just going to continue to remove that tissue so as to clear out the chest area. So now that the cat's chest is pretty much clean, his upper chest and upper arms are clean of the connective tissue, you can begin to see the muscle pattern and how it's striped. And so that was the level of removal that we wanted to have with our connective tissue. So the next step is to delineate. The next step is to delineate the muscles or isolate the muscles from one group to the next. And so what you'll notice, in order to do this, you really have to pay attention to the orientation of the fibers. So muscles have a point of origin and a point of insertion, and those are really the attachment points for the muscle. So if you look closely and follow the direction that those muscle fibers are going, you can kind of see here that these muscle fibers are striping and they're running along the horizontal. Whereas if you move down, you can see that the striping or those muscle fibers are arranged in a different orientation. So no longer are they traveling along the horizontal. They now, when we move here, they're now traveling more along an angle. All right? And so at that line where that transition occurs from the orientation along the horizontal plane to more of a diagonal, that's where that separation between one muscle and another muscle is. And so this boundary is where we want to make our cut. Never do we want to cut along the point of origin or insertion, right? It's always along the side of the muscle, so parallel to the orientation of those fibers. So I'm going to take my scalpel now, being careful because these are very sharp. And then I also want to use my forceps just as grip, all right? Again, never wanting to put my finger in the area of where I'm going to be using the scalpel. So I'm just going to very carefully, in one smooth motion, create a line that is going to separate, just following along the normal separation between these two muscles. And again, that seems to be about there. All right, so I'm just going to very carefully, and sometimes it helps to create a little bit more tension in the muscle to get a good cut by stretching out and opening out the cat. So I'm just going to make an incision. And you can see the cut, and it looks like I need to press a little bit harder. It's always better to err on the side of caution. And so then that creates a separation between one muscle group and another group. And so if this is the upper boundary for this muscle, this is going to be the pectoralis major, which is one of the muscles that we want to identify. Then I need to find the lower boundary for that muscle. And so for this, I'm going to set the scalpel down. And for this, it takes a little bit more close evaluation. So if you can see, and I'll use the probe, these muscle fibers, there's a separation here. And this doesn't always happen, but we're actually quite fortunate in this case. There's a clear separation, and you can see that because of the connective tissue in between these two muscles. The separation between what is the pectoralis major and the pectoralis minor. So this is the major, this is the minor. And you can see this line here. And that represents the boundary between those two muscles. And if we follow that all the way down, we see that it connects or merges at the sternum or the midline right around here. So that's where